Hi, everyone. Thank you for coming to today's webinar presentation for the Safety Planning and Seeking Safety Training for Behavioral Health Providers webinar series. A few announcements before we get started. Please make sure your sound is muted during the presentation. If you have any questions, please submit them in the chat or feel free to unmute if Avron Jen opens up the floor. For those requesting a CE or certificate of completion, I'll share an evaluation link in the chat towards the end of the presentation. To receive a certificate, you must attend the full presentation. Also, please note that you will have 48 hours to complete the survey before it becomes inactive. I will also be sending everybody a PDF of today's PowerPoint and a CE link to their email after the presentation. Also, please note that we are recording today's presentation, so feel free to turn off your camera or make your name your phone number or anything in case you didn't want your identity out there. If you have any questions, please feel free to reach out to me directly. I'll hand it over to Avi now. Thank you.
Hi, everybody. Just to clarify what Alex was saying, and I'm sure I've reminded you before, is that you know that there's 6 trainings that I and Jen do on Tuesdays and Thursdays. And this is the only session that's being recorded. So feel free, like Alex said, to de-identify yourself if you want to, or take yourself off in video if you'd like. Don't hesitate to contact us through the chat because that's not part of the recording. And I'll be careful not to mention any names. If I read something from the chat, I'll just read the question. And the recording is only available to people who registered for the training. It's not going to be like on Learning Central available to all. So just for your colleagues. So last week, we started our journey together with Seeking Safety, and we related it to safety planning, which hopefully all of you were able to join Jen and myself for our 4-week discussion. And as you know, we're going to progress through Seeking Safety with the emphasis that the majority of Seeking Safety is actually safety planning, and we'll tie it all together at the end, but we'll permeate our discussion throughout. So last week, we gave you the overview about Seeking Safety, the rationale for it, the unique structure of it, how it's one of the first, if not the very first, evidence-based treatment for co-occurring trauma and substance use disorder, how it initially started out with a sobriety-only approach for substance abuse, but quickly adapted to being a harm reduction approach, and that the method of administration of Seeking Safety is very much in alignment with how safety planning is supposed to be administered: collaborative, co-created, transparent, flexible, person-centered, not disorder-centered, strength-based, solution-focused, and shared decision-making, all of that. So hopefully you'll keep all of those sort of ways of implementing Seeking Safety. And as I mentioned last time, this is not Seeking Safety, quote, certification training for adherence to the model to provide a further evidence basis for Seeking Safety. It's implementation of Seeking Safety, which gives Jen and I a lot more flexibility in how we're approaching it with you and how it's intended in clinical practice. So today, what we're going to talk about is an overview once more about how Seeking Safety helps people attain safety in their relationships, in their thinking, in their behavior, and in their emotions. Specify which Seeking Safety modules might be prioritized if time is limited, and focus and ground ourselves in grounding and centering, because that's one of the key modules of Seeking Safety, and how that can help people suffering from severe psychological distress. And as we talked about last week, Seeking Safety is for people who have co-occurring problems that put them at risk. So it's not just trauma, as if trauma is a just. It's significant for so many people, unfortunately, but any significant mental challenges and problems and dysfunction that cause problems in day-to-day living, as well as co-occurring substance abuse. And we talked about the vicious cycle between the two, how substance abuse and dependence creates more opportunities for risk and self-harm as opposed to safety and security, and how trauma in its symptomatology and the way that it's expressed encourages, unfortunately, the use, misuse, and abuse of substances. And that's why it's so important to treat both at the same time by the same kind of treatment. Nothing to disclose as usual. So the first couple of slides, and as you know, I created this content. A lot of it's based on Najevitz's slides, and then my own, and I'll try and clarify which are mine and take the blame. But seeking safety is an evidence-based treatment that treats co-occurring diagnoses of PTSD and substance abuse, focuses on both diagnoses. And like I mentioned, maybe 2 or 3 dozen times last week, and we'll continue to repeat this, no exposure to significant trauma memories. That is not part of seeking safety. It is not an exposure-based therapy. So clear guidelines for how to approach this, and an emphasis on commitments. And like I always like to point out, one of the first therapies that emphasizes the commitments that we as providers and facilitators and coaches and mentors make to the people that we hope to help, not just the commitment that they make to themselves and that they make to us. So it's, again, it's a collaborative, co-creative, transparent approach. And for those of you who were able to join us about safety planning, you remember that suicidality-specific treatments, like the collaborative assessment and management of suicidality and CBT for suicide prevention, also emphasize the commitments that we make to the people that we're helping, both to show what trusting and secure and safe relationships look like, and to model the idea of compassion for self and compassion for others. It incorporates cognitive behavioral therapy and actually interpersonal therapy, dialectical behavioral therapy, motivational interviewing, and solution-focused approaches, as well as emphasizing skill development and improved coping responses. And again, does not include exposure to trauma thoughts. So there's about 25 topic areas that are looking at recovery and coping skill development. And the whole idea is attaining safety and security to build a trusting foundation for securing oneself and knowing which relationships promote recovery, safety, security, and are in alignment with your values and your reasons for living, and avoiding and minimizing dangerous relationships would put you at further risk. Like I pointed out last week, one of the innovations of seeking safety is one of the first evidence-based models that was steeped in cognitive behavioral and dialectical behavioral therapy that emphasizes not just cognition and behavior, but interpersonal issues, because the basic idea is that you need the support of others to support your recovery. You need to understand who will be engendering of your trust and your security, who has your best interest at heart, whom you can ask for help, versus the people who, again, endanger you, further your risk, and treat you as a disordered, dysfunctional person, as opposed to a person of value. So each topic includes a safety-oriented skill relevant to both PTSD and substance abuse. And this is really critical. Each topic is independent of the others and can be presented in any order. And like I always like to mention with seeking safety, one of its great glories is a frustration for a lot of people. It's incredibly flexible. And all the modules, I think Jen and I can readily attest to this, are universally applicable in all the work that we do. Because most of the people who see us come from a place where they're challenged by risky situations, crises that tax their coping mechanisms, and problems with natural supports in their community and in their family. So the idea is, again, that we think of physical health and emotional and mental health as adaptation to whatever life throws us, is our ability to adapt, flex, and cope. And so Seeking Safety models that. It's a highly flexible, adaptable kind of treatment. Individual, group, walk-in, closed group, crisis intervention, and again, all the modules you can use in safety planning. And safety planning is, again, a key aspect of Seeking Safety. So here's the list. And again, you're getting the PDFs. So later in the slide set that I gave you last week and this week, there's a brief explanation of all these modules. Today, what we're going to be focusing on is the first 5. Safety, PTSD, taking back your power, when substances control you, detaching from emotional pain, which is grounding. We're going to highlight that to a great extent today, and then asking for help. Safety is the core module. PTSD, taking back your power, is really psychoeducation about what does trauma look like, how does it manifest itself in all the various ways in all of us, and how do we cope with it. When substances control you is the same kind of issue. What does it look like to overuse, misuse, abuse, and become dependent on substances? How does it impact our cognitions, our behavior, our feelings, our interactions? How does that put us at risk? When is it judicious to use a harm reduction approach, and what does harm reduction mean? And then grounding and centering is universal. It's when people in full-blown state are dissociative, they depersonalize, derealize, or out of touch with reality because of the massive assault of what's happening to them, some kind of traumatic, cataclysmic kind of event, and how to get them back into themselves, back into reality, so they don't lose control. Because one of the paradoxes of trauma is the people who are most traumatized and feel most out of control lose control because of not being able to be in that horrific moment. So grounding and centering reconnects people to themselves, repersonalizes them, and helps them contact into physical reality, interpersonal reality. And then asking for help is actually very critical, and a lot of people are surprised by this. A lot of people don't know who to ask for help. They ask for help from the wrong people, people who wish them harm or do them harm, rather than people who are really attentive to their needs and who support their recovery. They don't know how to ask. They over ask, they ask for too much too soon, or they ask for too little too late. And so this is really helpful, again, as a uniform practice. So what I would say is, for all of you, looking at safety as a module, grounding and centering, and asking for help, they're uniform to all the work that we do, no matter what the setting, no matter what psychosocial interventions or medication interventions that we use. And the rest of them we'll talk about at length. Now, one little explanation, you see on the right column, midway it says coping with triggers, and there's an asterisk. Seeking Safety, again, was created in the mid-1990s and then first published in the early 2000s. And the literature was steep then. Instead of talking about what kind of situations are activating factors or precipitants, or however you want to say that, anything that happened in your context that provoked you or put you in a vulnerable state or a risky state or a self-endangering state, the word was triggers. And as we talked about with safety planning, we don't want to trigger people by constantly reminding them of the word trigger, because guns and firearms and triggers are something we don't want people to ruminate and obsess about and be reinforced about if they have issues with self-harm. And a lot of domestic violence is with the threat of firearms. So we want to use other terms other than triggers. So I'll always asterisk. And I would suggest that when you use seeking safety, again, the manual is embedded with that. I would substitute it in the handouts and tell people why you're doing that. So the three-stage model of recovery that Judith Herman first talked about, primarily for sexual abuse, is safety, and then mourning, and then reconnection. So safety is the first stage of healing from both PTSD and substance abuse. And the goals are to reduce substance use and self-harm, acquire trustworthy relationships, gain control over symptoms, attain health, self-care, which includes self-compassion, and remove oneself from dangerous situations. All of which, like we talked about, are the central aspects of seeking safety, the goals of seeking safety, the themes of seeking safety. Mourning is moving from a story of shame and humiliation to one of dignity and virtue. Now, seeking safety sets the stage for that, and some of the modules actually talk about this: recovery thinking, creating meaning, creating a new story. And like I talked about, narrative therapy, the narrative therapy of White and Epstein, developed around the same time independently of seeking safety, talking about how to re-author a story. So one of that is moving, as all of us know, from a sense of being overly identified with trauma, that you define yourself as, I have PTSD, I am a victim, to see that that's a part of you, and to look at opportunities for thriving and for growth in the midst of these horrific events. And again, self-compassion, seeing yourself as a person of dignity and virtue, offering value to yourself and to others. And as we've talked about many times, recovery is not the absence or the reduction of signs and symptoms and syndromes. It's the restoration, not the discovery, but the restoration of meaning and value and purpose in your life. That's an important distinction, because when you say discovery, it's as if it never happened before. But restoration means you've always had a sense of meaning and value and purpose, which has been obscured by all the issues of trauma and how you experience it and re-experience it, and substance abuse. And we're wanting people to reconnect to that part of themselves that emphasizes their value, their dignity, their reasons for living. Reconnection with joy and productive activity in the world. Again, seeking safety sets the foundation for that, but it is not explicitly addressed in seeking safety. The whole idea is sort of based in attachment theory, which seeking safety is very much steeped in, even though they don't use a lot of attachment-based techniques. And the idea for that is, like we know, that we need to have security within ourselves and understand which relationships engender security and safety in us, and use that relationship with ourselves and with others to reestablish our self-compassion, our dignity, our self-respect, our self-esteem, and most importantly, we connect to joy, generativity, purpose, and value. So safety stage is the initial process, and it's the first module in seeking safety. This entire treatment revolves around one central idea: you need to stay safe. Mourning and reconnections are later stages of recovery, initiated in seeking safety, but pursued in other therapies. Now, 5 core principles: safety, ongoing priority, integrated treatment, focus on restoring ideals, the areas of cognitive, behavioral, interpersonal, and case management. Again, seeking safety was one of the first evidence-based psychotherapies, psychosocial interventions, steeped in the cognitive behavioral therapies that specifically address case management right from the get-go. Again, we've talked about the problems with silos created between behavioral health treatment versus substance abuse treatment and addiction treatment versus physical health care. Seeking safety is intended to eliminate all those silos. Another silo is the difference between, quote, therapy and, quote, case management. They're all of a piece. And seeking safety, again, was one of the first therapies to emphasize medical care, self-care, supported housing, supported employment. So part of seeking safety and its structure is, what community resources have you looked into to help yourself meet your basic needs? And to build this foundation in your environment to support your own building of a foundation in security in yourself. So the focus is on, this is an obvious slide, the focus is on potential rather than pathology, personhood, humanity, as opposed to disorder. We don't talk about, I have people waiting for me, even who have PTSD, much less, I'm seeing PTSD patients. We're seeing people. Simple, everyday words, because we want to do our best to communicate. They teach us the language that they use, the culture they come from, their beliefs. Our job is to learn from them, to help them rediscover who their best self is. We don't want to use terminology, especially pathologizing, depersonalizing, dehumanizing kinds of terms. We want to use their language, their cultural understandings, relating the material to current and specific problems. This is not a past-focused therapy. It's a current, present tense therapy. The immediate present and the very near future. That is the emphasis in the time on seeking safety. And making best use of the time available. Like I like to say, is when you look at general populations, not the kind of populations that we see at UNM, especially on inpatient, but if you look at people overall, even people who have severe mental disorders and addiction issues, and would qualify for a diagnosis of severe substance use dependence, may have only 1 to 3 encounters with a behavioral health or addiction specialist in a lifetime, not just in a month or a year. So, like we talked about with safety planning, we need to stop siloing off again triage, and screening, and assessment, and intake, referral, intake again for a clinic, wait. If somebody has a crisis, they see a crisis intervention specialist, not somebody who can follow them up. We have all these ways in which we subdivide a life as if that's the way that a life is lived. So in seeking safety, it's all seamless. Every encounter is a therapeutic intervention. What makes it different? Focus on safe coping strategies, present moment, specific problem behaviors, treating PTSD and substance abuse at the same time. Again, not part, exploration of the past, exploration of trauma memories, and interpretive psychodynamic work. So the goal is helping you become safe. And as the first module ends, in the first handout, you may want to start thinking about what safety means to you. So it's again, we're focusing on what safety means to that particular person. And that might include, but might not at all encompass, managing trauma symptoms, coping with life without substances or with less use of substances, taking good care of yourself, finding safe people who can be supportive to you, supportive of your recovery. Free yourself from abusive relationships, prevent self-destructive acts, find good ways to feel good about yourself and enjoy life. So you can see when you look at this, right? It's exactly identical to safety planning for suicidality. How to manage symptoms through coping, how to take good care of yourself, finding people who support your reasons for living, not your reasons for dying, freeing yourself from relationships which further your reasons for dying, further your risk for self-harm, minimize your self-compassion and your self-awareness. prevent as much as possible or minimize self-destructive acts, how to keep the environment safe, and that includes the social, interactive environment, not just the physical environment. Find ways to feel good about yourself and to enjoy life. Reestablish purpose, meaning, value, reasons for living. Safety, the most important priority right now. And seeking safety starts with the safety module. There's a list of over 80 coping skills. The next two slides just elicit some of them. And these are not meant to be all-inclusive. As Jen and I can attest to, whether you're seeing somebody individually or in a group, you're always adding to the list. And one of the wonderful things about the group is that Nicole may have something that's not on the list that works for her. Gabriella might have something different that she can offer to the rest of the group. You pool your collective wisdom, and the group is then modeling there are people who want to help you in your recovery, not put you at risk. And everybody, even though they might struggle to handle one situation, has the capacity to handle another, and they can offer that wisdom and experience to everyone else. And like we know, giving to other people, even for people who feel most empty and depleted inside, builds hope and optimism, self-value, and self-compassion. So here are some of them. Asking for help, like I said, is a module in and of itself. Inspire yourself, how to leave a bad scene, another situation that encourages a whole topic within seeking safety. Persisting, making a commitment to yourself for your own welfare. Choosing self-respect. Choosing self-respect. It's a choice. Just like in safety planning, we start with emphasizing agency and the responsibility to minimize helplessness and worthlessness, and to enhance hopefulness as opposed to hopelessness. Take good care of your body, list your options, problem solving. There's always something different to be done that may be more helpful to you. Creating meaning, we've talked about, doing the best you can with what you have. And this goes to locus of control, that if you're looking to the kinds of changes that you hope to make, look at the changes that you personally have some effect over. If the only change that you see possible is totally dependent on other people, then you're again putting yourself in a helpless position. So do the best you can with what you have. Set reasonable goals and reasonable expectations for yourself. Don't set yourself up for failure. Set boundaries. That's key to establishing safety. Boundaries around yourself. You don't want to be overly open and vulnerable to people who will take advantage of that. You don't want to be closed and distant from people who are reaching out to give you help and support. Compassion for yourself, for others. Talking yourself through a situation before you act on it, right? So taking a step back, looking at the situation, choosing, selecting the best course of action. Seeking understanding, not blame. If one way doesn't work, try another. Again, problem solving. And this is a key one. Alone is better than a bad relationship. A lot of people are so desperate because they have very little self-compassion or understanding and feel so insecure within themselves that they leap to any relationship, even if they have every message in front of them, what Seeking Safety calls a red flag, that it's dangerous. So this is a really key point. Creating a new story, like we talked about, avoid avoidable suffering. Terrible things happen to all of us. Again, try to prevent what is preventable, and then have the coping skills for what is unpreventable to cope better. Ask others, asking for help. Watch for danger signs, like I just said, red flags, green flags. Protect yourself, soothing talk. Remember, one of the first aspects in coping skills is soothing techniques, as well as distraction techniques, using exercise, etc. And then stay safe. Stay safe. And the reason that that's important in that language is that that says, to that person sort of indirectly, hypnotically, you have been safe in the past or safer in the past. Find how you did that and set up the stage to do it again. Not that you've never been safe ever and you have to learn how to be safe, it's stay safe. The safety elements are through education, like we talked about, present time orientation, the impact of the condition dealing with urges and cravings, focusing on self-care, attention to relapse prevention. And the goals are developing a commitment to practice safety, master coping skills, utilize safety planning, report on safe behavior, asking for help, dealing with urges, utilizing your safety contract, like safety planning. Safety skills, safety themes, teaching of grounding skills. So in addition to cognitive behavioral approaches, the teaching of grounding skills, grounding, centering, is used to enable the client to self-soothe and disengage from destructive urges, emotional pain, and feeling overwhelmed. So again, when people are challenged by horrific circumstances, highly traumatizing, catastrophic events, one way of dealing with that situation is to pull yourself out of it. And full-blown dissociation is the ultimate way that you pull yourself out of it. You can't remember who you are, where you are, what's happening to you. It's all obliterated at the time. But unfortunately, that defense, however well it works in that moment, puts you at further risk because you don't know where you are. You don't understand on some basic level that you're being abused in a severe situation. So it puts you in a very vulnerable position. What grounding and centering does is find a way to reconnect to yourself and to reality without re-experiencing that trauma. It's a distraction away from that trauma and a refocusing on the very basics of looking at the environment and taking it in, knowing where you are in time, person, and place, re-identifying with your body. So research indicates that the kind of therapy process that I just talked about with safety planning and that I just talked about you today, transparent, collaborative, co-creative, person-centered, culturally competent. They're the expert, we're the student learning from them. We're the scaffold, not the foundation. That we look at shared decision-making, that unilateral decision-making, that we make the decisions for them. We focus on all the strengths and solutions and the competencies and the capacities that they have within them, as opposed to seeing them as deficits, as vacuums and holes and voids that we fill in. All those processes are absolutely critical for any of what we do, I would argue, but especially for safety planning and seeking safety. The format, checking in, some kind of statement, quotation, theme, image that focuses people on the theme that the group has decided on, or that you and the individual that you're seeing decide on is most salient to them. And you have a poster in your room that has all the seeking safety topics and a brief explanation of what they are, so they can make a choice. And they can say, you know, I can identify what's a risky situation. I don't know how to remove myself from it. Or I know this person keeps pressing me to re-experience what I've gone through, and I know it's not safe and good for me. I think they're trying to be helpful. How do I set a boundary about that? So then we learn what's salient in that particular situation that they bring in. It might be something that happened just that morning or yesterday, and what module to reinforce, how to select that topic that's meaningful to them, that speaks to their needs. And then reviewing that topic, the handouts, the skills, looking at that, and typically in every session, you can always fall back on grounding and centering techniques and safety and the safe coping skills sheets, because those are uniform, right? So if people have difficulty selecting, you can go back to all that. And again, in a group or in an individual session, you've made your own uniquely tailored list to that individual or to that group. And you can review that. Should we go back to how to ask for help, how to call for a hotline, how to understand if a shelter is dangerous for you and is poorly supervised and poorly managed, whatever it might be. And then looking at commitment sheets, being very specific about within the next week, I will promise to myself that I will do X, Y, and Z. And you, again, like in any kind of intervention, does this really speak to you? Is this something you can easily do? Is there something else that would be more valuable to you? Look at obstacles, barriers, rehearse it, practice it, brainstorm about all the alternatives to make sure that you're arriving in that moment at something that is reasonable for that person to do and speaks to their deepest concerns. Then you make a commitment to them, which might be that you're going to look up a resource, you're going to revisit this, that you'll be available in the interim between one meeting and the other if something emerges where they would like to brainstorm further with you or a new situation arises, whatever the commitment you make. And then at the next session, what you do is, after the check-in, you revisit as part of that the commitment. Did you follow your commitment? And here's how I followed mine as the provider, the group facilitator. And then the checkout to reinforce their progress. And just like with safety planning, remember with safety planning, the very last thing we do is, the one most important thing I learned about why I want to live is. So in seeking safety, when you're checking out, you reinforce, what I learned today is how to set better boundaries with people who I know are dangerous. So you're reinforcing what you spent the hour or the 90 minutes going through. So priorities again, reduce substance abuse, PTSD, increase safety. The check-in, we talked about last time, what good coping have you done? We don't start with what awful things happened to you, right? What good coping have you done? Again, in the Milton Erickson utilization, indirect, suggestive kind of way, we're saying you have done good coping, right? You have done it, okay? So what was that like for you? As opposed to saying, did you do any coping at all, right? So we're implying and making them look at, and remember the solution-focused suggestion. If they say, I can't think of a single thing, think of, well, what was a difficult situation for you that you handled even a little bit better than you normally do? Why was that different? What did you learn from that? Well, that was a safe coping skill. And it might be that you saw somebody who was really high in the street corner who normally pushes drugs on you, and you walked away. When many times before you would walk towards them and try and deal with the situation. And you learned that pulling out of that dangerous situation was wise, okay? So don't hesitate to actively pursue and creatively pursue all the ways in which they use good coping. There's always ways in which they do. And then did you complete your commitment? And then the community resource update. That's where you start, right? And then the quotation, which you can mutually arrive at the group or with the individual. You don't have to use the manual. Again, the manual was created in the late 90s, and it's primarily for white, middle class, upper middle class women who had sexual abuse and suffering from addiction. So it's not culturally competent, it's not uniformly applicable, and it's certainly rooted in the understandings of those decades ago. So feel free to use rituals or cultural understandings or mantras or poetry, whatever speaks to that person, to establish that theme about whether it's boundaries or asking for help or safety, etc. And then in-session demonstration, role play, rehearsal, individually tailored brainstorms can help deal with obstacles, etc. Practice, practice. And then name the one thing you got out of today's session. What is your new commitment? And your new commitment can be a slight revision of what you've already done. Community resources. commitment to recovery, and the core concepts. Stay safe, respect yourself, use coping, not substances, to escape pain, make the present and future better than the past. Learn to trust. Take good care of your body, get help from safe people, get help from safe people to heal fully, become substance-free. And again, like I talked about, that's what they're initially. We endorse the harm reduction approach, change that language, right? Make sure that we talk about harm reduction. If one method doesn't work, try something else. Never give up. Persist. Don't give up. And the therapeutic style we've talked about, the checklist. Now, the case management strategies, which again, we talked about before, the extensive list of them, the therapist tasks we talked about, the therapist process we have. Here we go. If you have only a few sessions, safety, PTSD, when substance control you, detaching from emotional pain, asking for help. So here we are, grounding and centering. I want to be grounded in that and give us enough time to do that. The goal of grounding is to shift attention toward the external world and away from negative feelings. It's essentially a distraction technique. To shift into something that's mindless, but nevertheless helps people reorient and free them from disassociation to make the connections that are important. It's called distraction, looking outward, centering, healthy detachment. It can be done anytime, anywhere, without others noticing. This is really important. Simple. Anything else must be practiced frequently for best effect. So we encourage that as part of somebody's emotional health, that they're always practicing grounding and centering techniques. And Jen, you've done many seeking safety groups over the years. Do you find that grounding and centering is something that you constantly are going back to in all the sessions that you do?
Yeah, I think like sometimes even something could come up where like revisiting grounding could be important in the group. And how it's focused on like the mental, physical, and self-soothing grounding and helping people kind of identify at what times different strategies for grounding are helpful.
Yeah.
And it provides like a lot for like kind of like brainstorming and thinking about you know, what's working. And there might be ideas that come up from the group that aren't sort of prompts for in the handout for grounding. So it provides for a lot of really rich conversation. And people bring up questions a lot, sort of, you know, giving an example when the distress is really high for them. And then a lot of times other group members will be encouraging and helping them to kind of feel like, you know, have you tried this? And, you know, because it kind of seems like this is so distressing and this is seemingly so simple. How could this possibly be helpful for me? So when there's some buy-in in the group, I think it helps a lot to be able to like build that like that confidence for people to try it outside of group. Yeah.
Yeah, I wanted to underscore a lot of things that Jen just said that were really important. So part of all these handouts in Seeking Safety is they're not exclusive. And like Jen was saying, is they provide sort of a lot of alternatives of options. And when we talk about it, it's like, none of this may speak particularly to you, what works for you. And like Jen was also saying, which is really important, some situations you might find that physical grounding is really important. Sometimes it might be self-soothing. And remember, it's the exact same categories as in safety planning, right? The first step is identifying warning signs, which is what we're talking about, the situation that evokes the concern. And then the coping skills, when to initiate this. And like Jen and I are both saying, that when in doubt, do grounding and centering, right? That's one of the first things to help you reestablish safety. And that, as we remember from safety planning, it's looking at distraction techniques, soothing techniques, exercise techniques, and it's very similar in looking at grounding and centering, like we'll talk about. Jen, another question to ask you, if you could share with the group. I know that you talk with a lot of the people that you see about your own journeys in recovery, and I'm guessing that you're pretty transparent about how seeking safety has been helpful to you. Is that?
Yeah, I think like the theme of headlines, not details, is like to maintain that consistency and to model that. Like if you're sharing lived experience, I think that sometimes, because it's like most groups I've facilitated have been a drop-in group, so it can take a bit to kind of warm up to one another. So depending on the group dynamic, I might bring in some examples to get the conversation going and to sort of create a place where talking about these things feels more comfortable and people feel safe to share their part. So that's one piece of it, and then kind of supporting the discussion and ideas going, like contributing in that way. So like I'll participate in the check-in, and I'm participating. My facilitation style is more participatory. So I find that to be helpful. And I think like in a one-on-one, it can be, you don't necessarily have to be in recovery to be able to be familiar with the skills and reflect on how they can be helpful. So I think that if we are familiar with them and practicing them, that there's many times where kind of warming up to it, that it can be really helpful.
Thanks so much, Jen. What I'm really proud of that I may have told you in the past is I was consulting psychiatrist and the co-principal investigator for the 2 5-year SBIRT grants. And in the second 5-year grant, we incorporated seeking safety as one of the brief treatments for people who had co-occurring substance abuse and trauma, mood disorders, anxiety disorders, or suicidality, or all of those above. And we trained peer support workers exactly as we train the social workers, counselors, and psychologists. They did the seeking safety individually and in groups. And my colleague Annette Casanti studied this and in other projects that we work with for people who are chronically structurally homeless, as well as having severe mental illness. And it won't surprise any of you that peer support workers actually had a better outcome than the other behavioral health providers, especially with engagement and with modeling. And this was one of the steps that the state took to both certify peer support workers and approve Medicaid reimbursement for peer support workers' work. So seeking safety is something that can be implemented by a lot of facilitators with a lot of background. And what Jen was talking about too is, again, the transparency is really, really helpful. And saying that we practice what we preach is always really helpful too. So it can be done at any time, anywhere. That's really important, because a lot of the kinds of quote homework assignments that we give cannot be. So here's the 3 categories that Jen just alluded to: mental, physical, and soothing. So mental is describing the environment or everyday activity, thinking of a safety statement like an affirmation, thinking of types or categories of things and listing them. It's the typical sort of cliched thing that we ask children to do when they're on a car trip, right? Look for all the license plates from South Dakota, because they're more difficult to notice, or just count numbers, or notice how many red cars pass by. That's, again, a wonderful distraction technique. A lot of meditative techniques and mindfulness techniques fall into the category of mental grounding. And physical grounding, which I have found incredibly helpful, like in emergency room and urgent care and drop-in situations where people are physically agitated, are hypervigilant because of a history of significant trauma, and they've been taught that they need to be hypervigilant, or they have psychotic features where they have paranoid delusions. that it's really helpful to pull themselves out of their mind and say, put your feet firmly on the floor. Feel the floor in your feet. Feel the counter below your hands. Feel the chair on your back. Feel that surface. Is it smooth or is it rough? It grounds them in physical reality. Notice your body. And this is, again, mindfulness techniques. A lot of us know when we're first introduced to mindful meditation, it's like peeling an orange, smell the orange oil, taste the texture, taste the sweetness, the difference between the rind and the flesh, putting into your senses, right? So touching around you, digging your heels into the floor, breathing mindfully, as we talked about, again, with safety planning, progressive muscle relaxation, deep breathing exercises, mindful meditation, simple meditation, all part of this. And then soothing, using all your senses. So it can be imagery, it can be remembering a safe place, it can be aromatherapy, it can be physical therapy, it can be something like yoga or Tai Chi, anything that involves the body in a safe way. So the body is seen as a vessel for holding safety and security, as opposed to a vulnerability that can be exploited by other people. So here's an example of the soothing grounding exercise. Let's start with your favorite color, your favorite animal, your favorite TV show, favorite time of year, favorite time of day. Think of a favorite person, favorite song. Now, why is favorite emphasized all the time? Because favorite is unique to that person, right? So it's not like, think of a color that you like, but you're emphasizing what you favorite, what you choose, what's unique to you. And it can be different for anyone else. And one little aside that I want to make is we're often biased about the activities, and we think of some of them as destructive or as opposed to soothing or helpful. One example I've come across a lot working with youth is video games. We think of video games as violent and individual. There's a lot of video games that are collective, where everybody has different charge for different resources. There's a lot of interactive video games that are highly creative about building communities. And so don't stereotype it, find the meaning that people have within their own. And then we always want to involve why it's helpful, like Jen was saying earlier, what particular situations call on for different techniques, and don't worry about the classification. That's another thing. Don't obsess about, does this fall into the mental or the physical or the soothing? It doesn't matter if it grounds and centers them in the way we're talking about, pulls themselves away from re-experiencing, pulls themselves away from significant avoidance and denial, pulls himself away from negative cognitions and emotions, pulls himself away from risky situations. That's what's most important. Connect these to the issues and the themes that may have emerged during the check-in. An example, sharing the personal aspects of emotional pain, right, combined with the teaching and discussion of grounding techniques. So instead of, again, having people re-experience, when they talk about something that's difficult, shift very quickly. How do you pull yourself out of that difficult state? What worked for you? And like Jen and I am implying, if someone comes up blank, instead of that we filter back to them, turn to the rest of the group. So if somebody's had somebody yelling and screaming at them, or saying how much they disappoint them, how they handled it. And again, there's always someone in that group. And you can bring a group into an individual session and say, you know, you've talked about this friend of yours who's very resourceful and helpful to you. If they were here, what would they advise you to do? Or what have they done that they've told you about that worked for them? Develop a commitment to practice the techniques between sessions. So that's one way you carry forward. If they spend a lot of time talking about remembering song lyrics or reciting poetry or listening to a particular kind of music or going out dancing or walking in the park or taking a hike or walking meditation, anything that's worked for them. Say, so how about this? Next time you have even a hint, right, that you're dealing with this difficult relationship, or you're feeling an urge or a craving to get a needle and get some drugs in your system, pull this in. And how many times do you think you want to practice this in the next week? 3 times, 5 times? What's the commitment you would like to make for yourself that we'll revisit next week or next time we meet? Any questions about grounding and centering and when you do it? The idea is most of the time, and about the flexibility of it and how you keep revising that list. Any questions that you'd like to address to me or Jen before we move on? Nothing in the chat so far. And again, you can contact either Jen or I offline if that would be helpful to you. You have our emails. So a review of the introduction to the treatment, getting to know the patient. Case management means we want to set that from the start. Again, that's not something that's an addenda. We look, do you have a stable place to live? Do you have nutritional anxiety? Are you worried about getting a meal for yourself or for your kids? You want to take care of that right from the get-go. If you don't have your basic needs met, you can't be safe. Can't be safe. The commitment to the treatment, what does safety mean to them? The safety module. PTSD, again, the psychoeducation, what it is, link it to substance abuse in the way that we talked about, that they might self-medicate with substances to minimize the symptoms of PTSD, using compassion to take your power back, grounding and centering when substances control you, and asking for help, need for help, and how to obtain it. Here's the other ones, the other modules in seeking safety. So going back again, that slide encompasses those ones that if you have limited time, try and cover these, okay? And you can incorporate all this. So when you're talking about safety, you can insert the information about PTSD and substance abuse and how they control the person and how they alter their experiences and what seems to be a solution in the moment that causes a problem in the future. And then immediately teaching grounding and centering, looking at safe coping skills, and again, how to ask for help and community resources. Here's the rest of the modules, which is what Jen and I will cover in the next 2 weeks. And again, the flexibility of seeking safety, how to implement groups, which we talked about briefly last time, and we'll emphasize that next week and the following week in more detail. The installation of hope. And I'm going to turn it over now to Alex. Here's the QR code. Alex has typed in the information about how to get your CE survey completed so you can get your CEs. As he mentioned earlier, he'll send you the PDFs. Jen and I are looking forward to seeing you next week to continue this discussion. And thanks so much, Jen, for all your helpful advice and wisdom and experience. It's really wonderful. Hopefully we're modeling to you about if you have 2 facilitators, how you want to interact with each other to help the group. Thanks again. See you next week.